comments, we'll get there. It's just a little bit longer today. So we'll get Board of Health set up and proceed with that. Okay.
Thank you all for coming. This is the Board of Health meeting starting now. We're a little bit late. Sorry about that. First item on our agenda is we have a new member who's joining the board, Alyssa Fine, and we're going to have Commissioner Dahl give her the oath of office.
I need my glasses. You're young enough. You don't.
I hope.
So I would just say, raise your right hand and repeat after me. I, Alyssa Fine,
I, Alyssa Fine,
do solemnly affirm that I will support the Constitution of the United States
do solemnly affirm that I will support the Constitution of the United States
and the Constitution and laws of the state of Washington,
and the constitutions and laws of the state of Washington,
and that I will faithfully and impartially
and that I will faithfully and impartially
perform and discharge the duties
perform and discharge the duties
of the office of Cowlitz County Board of Health member representing the Cowlitz Indian tribe
of the office of the Cowlitz County Board of Health member representing the Cowlitz Indian tribe,
according to the law,
according to the law,
to the best of my ability.
to the best of my ability.
Congratulations.
Thank you for that and welcome aboard. Next, we're gonna move on to the review the minutes. The minutes have been sent out. Did everybody get a copy of the minutes? I'd entertain a motion to accept the minutes. Somebody wants to?
I'll move to accept the minutes.
Motion on the floor to accept the minutes from the past meeting. All in favor?
So before we move, I just had a question. Were the minutes available online with the rest of the business?
It was emailed to all the board members.
Okay, but so the public didn't have an opportunity to look at it.
No, they are put online after they are approved.
I think previously they've been published after they're approved. Did you have a conflict with one of them, something in the minutes?
No?
So, any further questions about the past minutes? So motion on the floor to accept the minutes. I'll call for a vote. All in favor, say aye.
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 Aye, and I, so unanimously we pass. Next item is the opioid settlement lawsuit. Just, we've talked a lot about it, for the last several months. I just wanted to bring it up to see if anybody had further comments on that. My only comment that I was thinking is that this is money coming into the county, and that money might be able to be used for to replace the mental health tax. Instead of taxing the people, use the money, remove the tax and use this money that's coming in. I think that could be something that we could look at. Well, we'll just move on because that's horse has been beaten quite a bit. But
Just a comment on that. I think the opioid funding is going to sum up annually about 350,000 or so. And the tax revenue has been substantially higher than that.
I don't know if we've started, I think we started seeing some requests on that. I hate to you were up here long enough, Gina, but you know, when you look through the document, there's quite a few pages of how you could spin that. So it's,
Has the payment structure on it.
Oh, great.
Oh,
Thank
perfect.
you.
See what we
okay.
Nice.
Thank you.
So this is
Yeah.
what's expected over the next basically 18 years.
This is the cumulative between the two programs.
Between what two programs?
There's two settlements.
Oh, this is just the first settlement. I have not seen any information on the second.
The information I saw at the Board of Health training was that the second settlement is actually 4 times this amount.
Yeah, so this is what you see in front of you is the payment schedule for the first settlement. So there may be additional, coming. The top section shows what we've received so far, so about 400,000. And then each year, there's an allocation up to 2038 for the settlement dollars.
So if I may, Mr. Chairman, I'm a little lost. If I recall correctly, the first settlement and the second settlement were going to span about the same number of years and the same amount of dollars, same number of dollars. Is that not true?
I'm not sure. I'll double check.
Because I'm surprised when the chairman says 4 times. That's nothing at all that I recall being that like that.
Yeah, and I know the state puts out announcements about the settlement but the state also keeps a portion of the settlement dollars, so I can look into,
And what we're seeing here is the net to us.
correct.
Okay.
And then this settlement is with the drug companies.
Correct,
And the second one is with the distributors.
this
Yeah.
this one was with 3 different distributors.
Oh, this is the distributors. Okay.
Yeah,
All right.
yeah. So then, like I said, I think there's other settlements as well going on.
I found some notes here. There's a Purdue bankruptcy settlement. That's one's called, and the other is called Malincrot bankruptcy settlement. So which one was this one for?
There was 3 different distributors in this one. I don't have the names in front of me, but I don't recognize the ones you just mentioned.
He was mentioning manufacturers.
Manufacturers. Okay, so this one is the 3 different distributors. I could find it and send that out. I was just looking at it.
Yeah,
so-
I think it was just more, I was just wondering I know there's 2 different lawsuits and wondering
Yeah.
what side this was on. And I'm of the same understanding as Commissioner Mortensen, that they were both about equal. At least that's the way it was. It sounds like that could be different, but
Yeah, this
that
one,
was my initial understanding.
this one says 25 million paid over 9 years. And the other bigger one is 208 million paid over 15 years.
To College County.
No, that's to the state. So
Where-
they're divided by the counties
Where are you getting that information?
from the
Kelly?
Washington State Healthcare Authority from
Okay.
the training that we went to.
Oh, okay, great.
So
I'd like this to go up on the screen. Is there any way we could put that up there?
I don't think we have it in the system.
Maybe not.
No, I sent
If you
a,
want, I can go up and hold it up.
We are working on a landing page on our website and we'll post this up there as well as
Okay.
the
Yeah.
updates.
Oh, good. Okay, thanks.
and I'll resend this. It was just 3 slides that I took from that presentation. I'll just send that out.
Yep. And if anyone's interested, I have a couple copies with me. I think I just brought 2 though. It's about 17 pages long of the allowable uses. It is all focused on treatment and prevention for substance use disorders. So if anyone's interested in that full allowable uses and, we could certainly talk more about what the Board of Health's role is with opioid use and if there's strategies that we want to explore.
I'd like that.
Thank you very much, Gina. So just kind of blending into the same thing as the mental health tax. Is there further discussion on that?
Gina, do you have the numbers handy for the behavioral health tax?
Yes, but I left them back here. Just one second.
Okay.
Yeah, we tend to keep them to the end, but go ahead if it's a short, yeah. And we're just kind of, no, we're not doing any action on these, just kind of discussing them. There, if it's on my old business agenda, it stays there until I can cross it off, so.
Commissioner, you're asking about the revenue.
Revenue and what's unspent.
So I do have another similar handout I can pass out that shows, let's see. We're estimating about 2.5 million in revenue this year and about 4 million with ending fund balance, and I'll hand these out.
That's the ending fund balance if we were to end the year right now.
At the end of the year.
So we're still drawing stuff out there.
Thank you.
So an item to notice then is for this year, you anticipate we will be drawing beyond what the income is.
Yes. So, and what you see is what was approved in budget for 2023 with the mental health sales tax funding. And as you know, the Board of County Commissioners are well aware, we're in the middle of our budget process for the next 2 years. And one of the upcoming workshops that the commissioners will have is will solely be on mental health sales tax funding and what departments are requesting and reviewing those requests and so forth. So that will be coming, I think, in October with the commissioners.
Although if people are interested, we've met several times and those meetings are all on the website.
Correct. All of the departments have come and shared information with the board about their sales tax funding and what they use it for. Those are all recorded meetings that you can look back and watch if you're interested.
And I think you guys sent some videos, kind of the highlights cut down to the.
Where it starts.
Yeah, where it
Yeah.
starts.
Yep. I think all the departments now have met with the board, and then the budget workshop is kind of the next thing that's coming up to look at.
And I can add in this chart that you don't see, but for the gentleman who was asking for the admin charges, HHS charges 2% for handling all this.
And I think that's high, actually, with our actuals. I do have a few extra copies of the documents up here if anyone's interested.
So again, I didn't have any action planned. It's just on the agenda, I guess, until we're ready to take some action.
Good information. Thank you, Kelly.
Ma'am, was your comment on the mental health tax? Please go ahead if you'd like to.
My name is Carla Gibson, and I would ask that the commissioners please reconsider their decision to end the mental health tax. The tax provides for 2 of the 3 mental health officers who are trained to interact with high-need inmates of jail. They are a necessary part of the jail's minimum staffing levels. And losing these specially trained officers would require the jail to hire additional staff, likely without the same de-escalation training. Prior to the addition of these mental health officers, the Kellis County Jail was sued after 4 inmate deaths in 2013, 2014, and 2016, which was very costly. Since the mental health officers were added.
Can you push the button on your microphone?
Like that, can you hear me? Could you not hear me before?
We could hear you,
I
but the
can hear you.
recording wouldn't.
Oh, okay. Prior to the addition of the mental health officers, the Kellis County Jail was sued after 4 inmate deaths in 2013, 2014, and 2016. This is very costly to the taxpayers and the county. Since mental health officers were added, the department was not sued even after a death of an inmate in 2022. So these officers being present protects the jail from potentially very costly settlements that could end up in the millions. One thing that I hope perhaps we have finally learned from the opioid epidemic is that drug addiction is a medical illness, not a moral weakness. It requires medical treatment. Most patients with substance abuse diagnoses are also dually diagnosed with comorbid mental health problems such as anxiety, depression, and post-traumatic stress disorder. These are serious biologically based illnesses that require interventions by well-trained specialists for patients to improve. When dually diagnosed patients receive a qualified mental health treatment or medical treatment their chance of recovery is dramatically increased. This is the kind of evidence-based treatment that drug court provides. It has been proposed that volunteers might provide these interventions instead of qualified mental health and medical providers. These kind of patients who are dually diagnosed typically present with complex combinations of diagnoses. Prior to their stabilization, many patients can be emotionally labile, agitated, and volatile. It can require more than one highly trained professional to safely de-escalate a frightened or angry individual. Expecting volunteers, even those who have some preparation and training to manage unstable clients, will expose them to significant and very foreseeable risks. In the likely event that at some point such a volunteer were to be injured or killed, the county and therefore taxpayers would incur substantial costs in litigation following that. Finally, even if the mental health tax is discontinued, Cowlitz County taxpayers will continue to pay for the costs of untreated substance dependency and mental health treatment or mental illnesses. In fact, we will pay and pay and pay and pay. We will pay for emergency overdose treatment. We will pay for increased law enforcement needs. We will pay for the increased number of hospitalizations due to infections from dirty and contaminated needles. We will pay for involuntary hospitalizations when people cannot get mental health treatment. The difference will be that all these costs will be incurred by taxpayers in an endless cycle of rinse and repeat recidivism, instead of the evidence-based treatment offered through drug court that provides patients with the support and skills training and treatment that they need to end this cycle. Thank you.
Thank you.
My name is Carla Gibson. I'm not sure if I said that.
Thank
Carla
you.
Gibson.
Thank you for your comments.
Very good.
Please.
If I could make a statement, at the very beginning, there has been no formal decision from this board or the other board on the tax. In fact, we are doing the right thing by bringing it up early so that people have plenty of chance to comment, discuss it and all that kind of stuff. And that's what's going on here. And I know, I'm sure the board appreciates all that input.
Good morning, commissioners and board members. My name is Jim Hill, resident of the city of Kelso, 1100 North 22nd Avenue. Appreciate your time this morning. Commissioners, you saw an article that appeared today in today's daily news. I circulated. The article is specifically about a fentanyl bust that occurred in Lewis County. The product was transported through Cowlitz County. 5,000 fentanyl pills, large number of Xanax as well. Well-organized distribution system up there. That 5,000 fentanyl pills is a drop in the bucket, quite frankly. Here in Kelso, a year or so ago, we had a drug bust that occurred at our local train station, in which individuals transporting the product from Fresno, California, brought many thousands of pills up here. I don't have a lot of expertise. You commissioners know that my expertise is based on 2 years of service on the Western District Federal Grand Jury in Seattle. For 2 years, I can't tell you now how many cases I listened to that were drug related, but I want to tell you, I thought I understood the level of the problem and the sophistication of the marketing as well as manufacturing system. But once I got a look behind the curtain, it piqued my interest to the level that I have approached you before and talked about specific things, especially the availability of Narcan on our streets being provided. And my chief concern in coming here today is not folks that are over 20 years of age. I'm not sure if there's a program out there that is going to successfully turn those people around. I want to stick to people under 18. That's my concern, because those are the folks that are going to produce the profits for the cartels in the coming future. And believe me, they're being marketed to in a very, very organized manner. The expertise that I have on this subject comes from HIS, DEA, FBI, the folks that are involved with the drug programs prevention. None of them are, of course, are deterrent experts, but they promote trying to deter things. I can tell you that I firmly believe, and for 50 years, I've heard about the drugs, the war on drugs, and I don't see that we've succeeded, quite frankly. Mental issue, biological issue, doesn't matter to me at this point. What matters to me is the youth. And so looking into possible things that could be done to deter kids in the programs that exist on our high schools, all of our alphabet agencies out there, whether they're NGOs or whatever they are, if they want to know the dimension of the problem with 18 and under, they don't have a set of data that has been collected in one place they can go to and say, 100 kids went into the legal system, drug related. They don't have that baseline information of kids going into the judicial system because of drug use. And my biggest concern is the use of opioids and the growth of that in these folks, these young kids. What I'm here today is propose that this county needs to develop a system However, I don't know what agency, I don't know the mechanism, but we need to know at what level we're seeing usage among 18 and younger, how many go into the legal system. And we also need to have some indication of increases in programs that work to try to deter those numbers. You look at the only statistics that we have available, they're statewide and national, and the increase in the last 2 years is dramatic. And let me tell you, these people that manufacture these synthetic opioids, all of these drugs, they source the most sophisticated equipment worldwide. Their production capacity hasn't even been reached yet. And they really, it's just incredible. The level of sophistication, both in manufacture, distribution, procuring the precursor chemicals. Half of Asia has illegal, what we consider to be illegal precursor chemicals being imported. And guess what? They're not only manufacturing outside of our borders, there are small operations within the states that can produce an enormous amount of these products. We may not be able to save a lot of people 20 and older. I think we need to talk about younger, and I think we need to develop some baseline data to find out what programs work and what we can do. Because folks, we got a whole bunch of kids that are going to be on these products. We can't stop that. We can save some. Thank you.
Mr. Hill, I agree with you. And I will do my best to try to work on this. One of my goals. Okay.
This board has talked about the targeting children and prevention, and we haven't gotten to any plan yet, but we've talked about it and
Feels like there's some roadblocks. I'm not sure why in the educational area. So we need to work on that.
We have some wonderful on-campus programs. Epic in Longview, Highlander Hope,
Mhm,
Care in Castle Rock.
mhm.
Kids know a lot about
Yep.
the drug world. And, sometimes we adults don't listen. Maybe
I've joined the CARE Coalition up in Castle Rock, and I'm going to be attending those meetings.
in October, Vancouver.
No, in
Oh,
Castle Rock. I
okay.
live in Castle Rock. I'm going to be involved in that. And I feel very strongly about it, drug prevention in children. Okay.
And by the way, drug court, when that issue is finally resolved, I hope everybody understands it has worked. We need it.
You mentioned that, I just lost my train of thought.
I have those moments too, Mr. Mortensen.
You had said something. I just want to remind people, we've been staying inside the box for a very long time, and the results of being inside the box don't work evidently. It's not a question of philosophy, it's a question of the data and the observation. Our focus on the youth should be exactly as you say. So we're at least I'm totally in agreement with you there. The fundamental problem we have is that crime does pay. When in this case, I'm talking about the manufacture, importation, distribution of illicit drugs. And I know it's a very hard pill to swallow and very few people understand, but that prohibition doesn't work. Spending time with kids as in a family is your best solution so far. But going back to the money, I spoke to a retired DEA agent, and DEA agent explained to me everybody along the chain is making bank off of the war on drugs. the cartels, the local people in the local areas, the cartels, the local administration there in the production areas, all the entire agencies, we've got our own hands in the till. There are many, many people involved and they all make money off of that. So when I asked the agent, that's what she explained to me. And she said, the war on drugs will never end because there's too much profitability in that. The death in the article, you mentioned that something like we have to think about how we can make the people responsible. Like say if I distributed to you fentanyl and you died, I should be put up for a capital crime. I know it doesn't fit with the normal premeditated kind of thing, but you start making people be accountable for the damage they do and things will change.
The evidence that was presented to us indicated a couple of things. First of all, in order to stop existing users of chemical enhancements, you'd have to put a police officer next to him 24 hours a day for the rest of his life. It's that simple. That's a scary thought, but you know, we've thrown money at this for I don't know how long. And one of the things that I'm fully convinced of is that we used to blame folks, other countries and cartels and things for drug use. And you know, it's a personal thing with the users that make the decisions to utilize these things. But when it comes to kids, they can be influenced and they can be manipulated. And I don't care how many times an adult tells a child, don't take that fentanyl pill. If the other side is giving them a message, and a very sophisticated message, and they are of susceptibility, their personality is such, or even the sense of hopelessness, which is a big driving force behind kids are getting on drugs, quite frankly. But if that message is delivered, and it is being delivered in such a sophisticated manner, those kids are going to make wrong decisions because it's just the nature of folks that don't have the life experience and have gained the life experience that would make them make a different decision, so to speak.
The only comment I'd have on that is that when we're young, we're indestructible. And we always think that can't happen here. I can try it once, I can have one beer, I can have the drink and everything will be fine. And sometimes it's true, but sometimes it's not. People are going to experiment and try things. I think the best we can do is make sure that we don't have an out of control black market where people engage in something of which they have no idea what's in it. We saw that during Prohibition with bootleg booze that was messed up and people died as a consequence. Didn't work then. I don't see how it'll work here today either, how we're doing it.
Well, I think Mothers Against Drunk Driving was very effective in how they
Exactly, yeah.
Mothers Against Drunk Driving. I really felt like that made a difference. And I also believe the DUI laws made a difference too, because I quit drinking at taverns worrying about getting picked up. And I'm just a pretty normal person. And so I think there has to be a deterrent of law enforcement plus strong education that scares the kids. I don't care what people say about scaring the kids. They have to see those wrecks. They have to see those addicts on the street going through DTs and detoxing and what it's really like in life. We had a young man at one of our meetings that had seen one of his friends die from fentanyl. And he said, I wish I could go and talk to other kids around the city and counties about what I saw and let them know what it's really like and maybe have some videos that are reality, whether the parents think it's harsh or not, or whether educators think it's harsh. Reality needs to be seen so that people will understand. You can't just tell them. And so Kelly and we really feel very strongly about this and we want to make a difference. And I hope we can. If anyone wants to get involved, we would certainly love to be a part, have you be a part of us, because this is a tough thing. And it needs to be pushed hard now while fentanyl is the happy drug. We're going to have other kinds of drugs too. Thank you.
I will say this, I agree with everything you've said, but it's too bad we adults can't make a trip to a morgue and see the young folks there.
Yeah.
Because they're gonna start dying at the same numbers that adults are.
Yeah.
It's that point. Fentanyl, I mean, these drugs are lethal,
It's terrible.
lethal. And I have no answers beyond the fact that we gotta try.
Education.
And we can't do it. We're not gonna be successful with the older folks, the current users. We gotta find a program that works with those young kids. And we may start by bringing them in and just talking to them. It'd be a wonderful presentation for you folks to hear.
Thank you for your comments. Very appreciate it.
Everything that man just said is true presently. And let me take it back to 1986 when this little rookie firefighter was with District 2. I can tell you a lot of war stories. I even picked up some of my own classmates that were dead. There's a couple of rooms in a certain hotel in Kelso that you'll find some gaps on the second floor. There was a meth cook there. There was a house out in Lexington that blew up in our face because we weren't trained at the time. The first trained drug investigator was one of my father's students. All of my family's in education all over the world except this idiot right here. He decided to become a forestry engineer and firefighter, big deal. I also have a quarter into a master's degree at a certain university in Portland, and my instructors were a criminal psychologist and an MD, a policeman from Oakland before Miranda when they still used rubber hoses, and a lawyer, a member of the bar of the state of Oregon. The criminal psychologist and the police officer all met at the Rand Corporation when they were trying to stem the flow of drugs in Florida after Batista was overthrown by Mr. Castro. And I also looked at the federal court record for the United States District Court for Western Washington on the deaths in the jail up in Tacoma at the old train station. I could only read one transcript because they're voluminous. And that one transcript blew me away. The 4 deaths you had here in Cowlitz County. And it did cost the county a lot of money. Because once you take control of a person, you're responsible for them when you arrest them. It's a really interesting read. I wish I could go back and read the other 3 transcripts because there's some stuff that makes the hair I don't have anymore stand on the back of my neck. I'll end with this. The officer that was first trained as a drug investigator had to go to California. It was one of my dad's students. And what happened to him, maybe some of you know. He got it in the back of his neck, point blank by his own daughter, because she was wigged out. But I have another relative who spent 30 years in Tacoma PD, and I have a classmate who's a FBI agent. Here's the sewer pipe, as they called it. They call that I-5. Starts down here in California, and it's overflowing, just like the gentleman said, goes up to Tacoma, then it goes over to Yakima, and then down through the gorge, it goes back down to California. And it got so bad at our entry point down in Richfield that the transportation officers wanted to be armed because what they were finding in the semis, weapons, drugs, money, white slavery. And I'm sad to report it was U.S. Representative at the time, Linda Smith, who discovered that. And the U.S. District Attorney in Tacoma just kind of, it's not happening. Well, let me tell you, the Washington State Transportation Officers, they're armed now for a reason.
Thank you for your comments.
Taxation is theft. Mental health tax is theft. Being ripped off every day and it needs to stop. And if you don't stop it, I'm really gonna out.
Thank you.
My goodness. First and foremost, I want to say education and the principles to educate kids is number one. It's primary. I don't care if you're trying to teach them about drugs, alcohol, spam on their computer, on their phone, ransomware. There's all kinds of people out there finding ways to try and get your money, cheat you out of something, or kill you if that's how we got to get your money. The drug issues are a very real problem. It needs to start at an early age on the education level, and it needs to be taught in the schools. It should be taught in the schools on a daily basis. It's very difficult when you have, in my mind, you have a government that's got an open border policy that's promoting drugs and sex trafficking coming through the border like we don't care.
Yeah.
We got to change our immigration policy. The immigration policy could be changed at any time if you had the will to do it through the Congress. Open borders and security and sovereignty of this country has got nothing to do with the immigration policy. Those are two different things. Anyway, moving right along. I would like to address some earlier statements that were made specifically. There were some earlier statements made about concerns that doing away with the mental health tax was to do away with some mental health professionals. I don't know. I haven't followed any of that, but I would like to address the fact that whether you have none or you have 100 mental health professionals in this county doesn't guarantee you're not going to get sued. That's a fallacy. People can sue you at any time for any reason. The fact that somebody died in 2022, the statute of limitations isn't even up on that for somebody to file a lawsuit. So that's a misnomer. Needle infections, overdoses, and drug dependencies. My God, look at California. Some of the states that are spending millions and millions of dollars on a daily basis. They've got some of the highest problems there is. You're not going to stop those problems. You can address some of them. And yes, drug court can help some people, but it's not a golden cure. It's not the golden answer. We need to provide those things. But the biggest thing is education. And the biggest part of that education is a family values and the wisdom for the people with, and I hate to say religious, but basically those backgrounds that stand up for in groups in the community and say, we care about each other. We're going to take care of each other. That's where we got to get back to, is to say, yeah, I can give you a hand up, but I will not give you a hand out. You've got to have, the other side of that is those people have to be willing to change. They have to be willing to reach out and take your hand and say, yeah, I want a hand up. Education. It's all education. If we fail in that, we're not going to fix it. We're going to be feeding the problem and dumping money into a rat hole for the rest of eternity. This has been going on forever. It's just worse now because of the new drugs and everything's being manufactured on a daily basis.
Thank you.
Thank you.
Thank you.
Wow, there has been an awful lot that has been brought up with regard to this mental health tax that apparently is gonna sunset if it's not renewed or what have you. We've heard about deaths in jails, we've heard about education, we've heard about theft from the government as far as taxes, we've heard about just the borders. We've heard about so many different things. And I would definitely encourage all of you to consider those things. What the fundamental assumption that is being made that I can speak to, not as an expert, but as someone who is educated and employed as a behavioral scientist. There is nothing to know as to whether or not something is a positive reinforcer or a negative reinforcer until after the fact. You have to look at what the consequences are. And positive reinforcement or positive and negative in that in the context of reinforcements and how science for the past 150 years has determined what people do and how they act and how you can best intervene with people is not negative as far as, oh, this is a bad or a punishment, or positive as this is a reward. It's just simply literally plus or minus. Does the behavior increase or does the behavior decrease? So all of these things that people have been talking about are things that they are presupposing are going to be positive and negative reinforcers depending on whatever data and sources that they have turned to. However, mental health is not as readily observable and as tangible as physical health. If someone has a broken arm, you can see what it is, you know what the treatment is, and you can apply that. Okay, with mental health, I don't care what person goes to drug court. I don't care what person enters a treatment program or how they do it. There is no mental health intervention that works without the person's agency. They have to choose. You can force them, and maybe that set of circumstances facilitates them hitting rock bottom, but it won't matter, which is why there is recidivism. Now, I do not want this tax to sunset. And I think that those who would speak against that particular point of view or hold opposition to that are speaking more to the fact that they feel that it's a theft or they feel that it's worthless because what it's going towards has not been effective. Conservatives may want to think about the box and liberals may want to think about what's outside the box, but either way, in fact, it has to come into the box. Maybe it changes the box, maybe we preserve the box, doesn't matter. What we want is we want our money to be effective in what we're doing. We, the people, also share a great deal of responsibility in the failure when people choose drugs or other things like that, because on the social level, and again, research bears this out, the stronger a person's social support network is, and the more diverse that is, and the more extensive that is, the more healthy of a lifestyle they lead. So if we're going to continue this tax and we're going to address the concerns of corporations, both legal and illegal, illegal being the cartels, because that's exactly what they are. They are a business. They operate just like a business. Their tactics are just a little bit more extreme than what, well, can be more extreme than what legal corporations do, because there are things that legal corporations do that are just as abhorrent as what cartels might do. But there could be things where we take this tax and we're calling it a mental health tax, and we're applying it to things that incentivize NPOs, because those would be private organizations. There could be things that businesses themselves might have an interest in. We definitely have a number of private organizations within Cowlitz County that work to the very heart of the social problems that speak to why somebody turns to drugs in the first place. And so it's kind of, in fact, it's kind of a, there's a whole side of the a whole coin that you have to look at. Yes, we come to you and we say, if you're going to tax us, then the absolute baseline expectation that we have of that is it does what you say you're going to do. And our responsibility, at least in this regard, is to own up to the social deficiencies that we have with our families, with our communities, with our churches. And government can partner with that, because in this country, that's exactly how it's supposed to be. The government serves the people by coordinating with the people. So just bear that out. Think about the positive and negative reinforcements, and maybe that's where you start to look at. Do the things that this tax have done, is there evidence to show that what we're putting this money towards actually discourages people? Or do they just simply find ways to avoid punishment? And maybe there's other ways that we can deal with people who pursue that, because that would be what the criminal justice system would be for.
Thank you. If it's brief, keep it brief, please.
It's brief. Going back to just Cowlitz County. Like I said, all my siblings and my parents and grandparents all had postgraduate degrees. My father, who was a vice principal in the Longview School District, vice principal is considered the disciplinarian. So he had to, back then it was alcohol and marijuana. And he partnered with a police officer who later became Cowlitz County Sheriff, Chuck Gill. And they coordinated, but the police chief of Longview at the time thought it was, they denigrated him. They called him the kitty cop. Well, he was trained, my father, by an Army JAG officer, so Officer Gill was really interested. And they stopped a lot of the drinking parties and the marijuana parties. And you're talking about, here's what was put to us. Is it a product of environment, or is it ingrained in the human psyche? And this goes back to prohibition. We tried legislating morality. You know what we got? Organized crime. And the only public official, the FBI director at the time, just held up his hands, and he was co-opted by organized crime. And the only man that ever tried to stop it, he's in Arlington next to his brother, Robert Kennedy Sr. And that includes his brother too.
Thank you.
Hello, my name is Becky Morkert. I was going to wait till last, but it seems like this is the topic that's come up now. So I guess I'll go forward now. I'm concerned about the mental health tax too being cut, because if it gets cut, the Cowlitz County Therapeutic Courts will probably be cut and not supported. We have drug court, we have mental health court, we have Hope Court, and we have juvenile court, which is the safe court for the juveniles, and we've addressed those. These courts really do make an important impact on our community. I'm a lifelong resident of Longview. I've been in banking and financial management for 35 years. My husband was a fireman for 35 years. We own a business. And so we've been around a long time. And when Judge Warning started this drug court in 1999, we went, wow, this man really cares about our community. We didn't realize that eventually that we would need that drug court. And we adopted 2 sons. So my story is going to be kind of personal. We adopted 2 sons. Our youngest was an excellent student. Graduated with 3.97, got a college scholarship to the University of Portland to play golf. And after 2 years, he went to a golf college in California. And when he growing up, no drugs, didn't drink, excellent person, came back from California with a drug habit. And I mean, we were shocked. We didn't know what to do. I mean, we were absolutely devastated. We isolated ourselves. We were ashamed. And we absolutely didn't know how to handle this. I mean, we always raised him right. During the time he was growing up, the drug program, you know, I can't remember where the Longview had a drug program in the schools. DARE, yeah, there you go. DARE was in the schools. I mean, we supported that. And so we thought, oh, we had this handled. We didn't drink, we didn't smoke, we didn't do drugs in our home. So he was never around it. But yes, peer pressure got to him. And when they started using drugs, it's like the drug calls your name. And he couldn't stop. He didn't know what to do. And when he came home, we tried everything to get him off drugs. Finally, he got in trouble. And we had the opportunity to go into drug court. And for 2 years, he spent time with the counselors, going to group sessions and doing everything he was supposed to do. The only thing he didn't do is there's only one thing you have to change to get over your drug use is you change one thing, and that's everything. Persons, places, and things. And he wasn't willing to give up his friendships and the places that he went. So 2 years later, he did not graduate from drug court. And I know you guys like the statistics of how many people graduate and how many people don't. Well, he was one of those ones that did not graduate. But I'm here to tell you guys that drug court works, because a year later, he used all the tools that he was given in drug court and the mental health courts. And he went back to school. He got a CDL license, he's a Class A CDL, and he's been driving semi-trucks for the last 5 years. And so he wouldn't have done that if they would not have given him the self-esteem, taught him how to be happy again and have focus and goals. And so for you guys to even consider, you know, dropping that program is just, it just really bothers me. It really hurts my feelings. It really, because this is what we need. We need kids, when they get in trouble, they need to have a way to get out of trouble. And he got his self-worth and his self-esteem back because of that program. Yeah, he didn't graduate, but he looks back at that program, and that's the reason he was successful today, is because of that program. And so I just want you to not always look at the statistics of how many people graduated and how many people went in. I mean, there's a lot of other people. There's a young man that was with him during drug court too. He opted out at the same time. This young man now is a self-employed contractor, and he has a family and has 2 kids. And so there's good things that come out of drug court, whether you graduate or not. And so I just really hope that you guys do not sunset that mental health tax. It's already there. We're already paying it. So why take it away? Use it for effectiveness. I mean, there's going to be times when these younger kids are going to get in trouble, and they're going to need to be going into this safe court. And that's, again, another way. Good people get in trouble. Good people make mistakes, but we have to be able to let them be able to have a way out. So I appreciate your time today. Thank you so much.
Thank you. I'd just like to point out one thing, that ending the mental health tax does not necessarily mean that drug court is canceled. That's not how, from what I understand, it works.
Well, I'll come right out and say, I don't want to pay the tax, but if it would do some good, it's something that has to be. But the definition of his insanity is doing the same thing over and over again and expecting a different result. We need to get police involved in all this. We need to start busting the criminals that are selling the drugs and put such a stiff fine on them or a stiff penalty that they don't want to do that no more. Or they're not out on the street for 20 years. If they're caught selling drugs, 20 years, no problem. If you're a student caught selling drugs, 20 years, no problem. Those are the kind of things we have to do to stop this. I was born and raised in Southern California. And I had an uncle that was a narcotics officer on the LAPD. He was a lieutenant. When I was in junior high school, he took me down to the funny farm because back then LSD was very popular and there were a lot of nutty people after they took LSD. He took me through the funny farm and showed me all these people that had been taking drugs. I'm not a goody two shoes. I'm a loudmouth. Sometimes I'm an asshole and a lot of other things involved. But I've never taken an illegal drug in my life. I do not drink. I don't follow sports and terrify my wife with them. But I was addicted to morphine because of a back injury. That's what got me retired. The doctor put me on morphine for 3 years. I took myself off of it because I realized it was becoming an issue and a problem. Even though I could walk, it wasn't the solution. And I don't know the answer to any of it, except make the penalties so stiff that they don't want to do it. And so you got to get the police involved. This tax, if you just keep going around, no, 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 they're going to keep doing it. Make it hurt. Get the police involved. That's the only issue that I've got with it. I don't mind, I don't want to pay it, but if you'll do some good, I will.
Thank you. So I'd like to, is this on the same issue? Please. In the interest of time, we'd try, please keep it brief.
Well, I will try, but I have a lot of notes. It's a personal, mine is also personal. My name is Sharon Harmon and I live in Longview. I've lived here all my life. I was born here. And I am just want to talk about the same issue. But mine is a personal story telling you about my life with a drug addict and how Drug Court helped. And my life was a living hell for many, many years with my son. And he was raised in a Christian supportive home. My son had been in addiction for about 20 years. I had no idea that he was using drugs till he got fired from his job at Alpenrose. Even though he was asking me for money all the time, I knew nothing about drugs. And I just thought he was having hard times, making his rent, paying his car payment. After that, but then I found out after why he got fired. And after that, it was continuous hounding me for money. I ended up spending $100,000 of my retirement on him, thinking that I could help him. Anytime he'd ask me to do anything, help, I'd take him places. Let's get out of town. Let's do this. Let's go somewhere. Let's, and he said, okay, maybe that'll help. And all the time I know he knew that that wasn't going to help. So I joined a support group called Nar-Anon. And because I had no idea how to handle this. And then they would tell me what to do, what not to do. But I couldn't. I just could not. I could not do it. I loved him and I didn't want him to quit loving me. So while growing up, my son was a very funny boy. and he always kept me laughing. And when he became a drug addict, he was not that way. But he went in and out of many drug programs. He was in jail for a whole year one time. And finally, he did so many things that he was going to go to prison. And so it was drug court or prison. And he did not want to go to prison. So he did do drug court. And many of my Nar-Anon friends, me, I never gave up hope, but we didn't think he'd do it because he was such an addict. I saw him overdose many times. But he did. And he'll tell you to this day, drug court did it. Drug court is the one thing that turned him around. And he is now my funny guy. He is back. He has a job. He has everything he thought he'd never have again. And he is just a wonderful person now. He is a most wonderful person that he has never been in his life. And every day he is better and better. And so what makes somebody change is they have to hit bottom. And his bottom was prison. So I'm just hoping that, and I even have a grandson that needs mental health, but he does live here. And so I just hope this program can keep going because it does help. Thank you.
Thank you.
Hello, I'll be brief. For me, I think the question is not with the mental health sales tax, do we like one program or do we not like it? The question is, do we have a need for mental health services in our community? And the answer is yes. We have substance use disorder problems. We have people experiencing mental health crises. We need increased access to treatment. We need increased access to prevention. The behavioral health tax is 1 penny on $10 that local citizens spend. To me, that is a great way for the community to be co-creators in solving the problems of this lack of access to treatment and this lack of access to preventative services. So the question is, do we want to continue to use this tool we have in our toolkit to provide programs that can give increased access to treatment? Yes, we need those tools. Please look at the mental health sales tax not as, do you like the programs or do you like taxation? But look at it as a question of, do we want to continue to work together in our county to solve the problems of a lack of access to treatment and a lack of access to prevention? Please keep the behavioral health tax. Thank you.
Thank you.
Good morning. My name is Teresa Purcell, and I am a citizen of Longview. Thank you so much for the opportunity to be here. I just wanted to take a few minutes. I actually didn't come to speak about the mental health tax, but I'm going to right now because I am right now dealing with a mental health crisis in my own home. And when we talk about mental health and we talk about drugs and we talk about all of these issues, I just want to make sure that we're clear that when we talk about the mental health tax, your comment was, well, we'll find the money somewhere else. Well, we haven't, where will we find the money? That's something that is, to be very, very clear, and I want to support Mr. O'Neill's comments about the fact that this isn't about the programs. Let's figure out what programs will work. But right now, the system is failing everyone. And when we talk about children, we have to look so much further upstream. We have so many parents who don't have the tools that they need to parent effectively. We have grandparents raising children. We have, when you can't decouple mental health and substance use. You can't decouple the lack of opportunity and hope with mental health and substance use issues. The issues that we have are so, you have to look so much further upstream if we really want to help build if we want to get out of this, so we're not just dumping tax dollars down the hole. I am a huge advocate for the efficient and effective use of tax dollars. But just saying no and not having any solutions just ends up, we have more people in the emergency room, we have more people in jail, we have more people in the morgue, and we have more people in crisis in our community, potentially doing harm. So I beg you and I'm happy to help in whatever ways I can, but to understand that we have to go further upstream. We have to make smart investments, and those investments, we know the drug court works. We know there are programs that are working, and there's programs all over the country that are working that we could look at to model. We need to come together and say, how do we use these buckets of money? Because there's also additional resources to come to bear to make the smartest investments for our community, and to understand that it costs us all more if we don't make those smart investments. We don't use the tax dollars that are available, and we also don't work together. That just makes the system work. That just makes the system fail, and we're failing our children, we're failing our citizens, and we're failing our community if we don't look at how intersectional all these things are. Let's focus on how do we actually serve the needs of the community? How do we actually make sure people have access to care? How do we make sure parents have access to the tools that they need to support their children so they're not driven into the despair that is a byproduct that drives people to use? And the connection between mental health and substance use is irrefutable. So I encourage you all to please maintain the tax, but also let's work together to be creative about how we make sure that we're putting in place all of the systems necessary to have the citizenry of Cowlitz County thrive. So we're not stuck in this race to the bottom. And I appreciate your time. And I also just wanted to mention there were a couple of other things on the agenda today that I would encourage you to table. The medical freedom resolution, I would encourage you to table for another time, or to just vote against. Thank you so much for your time. I appreciate your work, and I appreciate all that you're doing. Thank you.
Thank you.
Well, I made a presentation to this body about, I don't know, a couple of weeks ago or whatever. I'm a proud member of the Oneida Nation, and I am an addict. My drug is alcohol. Alcohol is an insidious drug because it's so approved. There are many taverns or whatever. I'm friends with Judge Basher. Judge Basher told me of a time when he was by the lake and one of his drug court people said, "Judge, I've been here one day. I've been clean one day, and tomorrow's another day." I beseech you all to look at the problems we have. I talked earlier about the problems, about the various drugs and whatever. I just want you to know that I'm for the extension of the tax. Thank you.
Thank you. So I'd like to close out that segment. And we'll carry that over to another meeting because there's still lots to discuss on it. Please.
Excuse me, Chairman, just a quick thing on the timeline. Gina, the tax expires in March of 24, right?
Correct.
And how much lead time is needed, if any, for continuation?
I believe we need to submit something to the state in December. I'm not sure exactly if there's a specific day, but I think by December, we would need a decision to submit the documentation to continue.
And how much lead time do we need if we do not renew the tax and then choose immediately thereafter to bring the tax back? How much lead time does that need?
I don't know the answer to that. If you discontinue it, but then
Right.
bring it back, not renew it.
Yeah, let's say we let it expire in March and in June, we say, oh my God, that was a horrible mistake, or, something like that. We
Yeah.
decide to bring it back.
I'm not sure. I know historically it's been renewed. It's been
Just-
scheduled to sunset the end of March, and then when it renews, it starts collecting in April. So I'm not sure if that's tied to something with the state. That's just historically what it's been on. So I'm not sure if it would start sort of mid-year, for example, if you chose to do that.
All right, thank you.
With, thank you on that. And I just like to just voice for some of my constituents is the tax, they're being taxed to death is what they're telling me. These are some of the old guys that are on fixed incomes and they're getting ready to go on to food stamps. So there's a strong argument from them to get rid of the tax. And like I said before, removing the tax does not necessarily mean there's drug court is not is removed.
Mr. Chairman, we have one of our board members on Zoom that has her hand up.
Can I go, excuse me, can I go ahead?
Yep, go ahead, Mary Jane.
Can you hear me? So I have two questions. Number one, does the decision of the mental health tax come before the Board of Health? So will we be making a recommendation or a decision that moves to the county commissioners? That's my first point. And my second point is, I think I'd like to go ahead and pull the STD agenda item off the agenda because it appears that we are well over the time allotted us for a Board of Health meeting. And I recognize these are important issues, but I want to be respectful of the people who took time away from their work, who took time out of their day to show up to talk about some of these issues. So those are my two comments
Thank you. Yes,
and questions.
yes, the board will recommend something when we're ready to take a vote on it, and that will be pushed to the commissioners.
Thank you.
That answers your first question. So yeah, we are moving on. We started a little late. We're running a little late. So I would say I'm gonna take off the table, the medical freedom resolution for another date. And then if I'm gonna leave it up to HHS, if you would like to present your presentation or not, up to you. If I've been told it's 15 minutes.
This is Mary Jane again. I recommend, we've already kept these people here almost 2 hours. I would recommend that we table it for another meeting. And again, in light of being respectful of the people who showed up.
Well, the doctor just stepped up and would like to do it.
Okay, I'm in then. Thank you.
I will do whatever you tell me to do.
Thank you very much, Dr. Krager. Sorry to hold it off so long, but we do have a presentation on STDs that was actually requested by our board members.
Gonna say good morning, but it's almost afternoon. So my name is Dr. Steve Krager. I'm the Deputy Health Officer for Cowlitz County. We were asked to provide some slides around sexually transmitted infections, also known as STDs or STIs. So we've provided some of this data before, so I might be able to move through it fairly quickly if it's okay with you. But I'm happy to answer questions as well. So thanks for having me. Let's go to the next slide. Just a couple notes. First of all, I just want to thank Shannon Hoskins, our contracted epidemiologist, for putting these slides together and gathering this data. A couple things. This does not cover all STIs. I'm going to cover kind of the bulk of our work is what I will say, which is chlamydia, gonorrhea, and syphilis. Obviously, there are other STIs, but most of our work revolves around that. So that's what I'm going to focus on. But if you have questions about other STIs, I'm happy to talk about that as well. So we're going to just look at kind of like what our data looks like in Cowlitz County as well as across the state. Talk briefly about how these are transmitted and some long-term health effects that can happen. Look at yearly counts kind of over time and then compare with the state. So let's go to the next slide. Okay, this is our overall burden of what is reported to us. So these are reported by healthcare providers and labs. Chlamydia makes up the bulk of our cases, so about 3/4. And then gonorrhea and syphilis are kind of the next biggest ones. Other is mostly herpes, so HSV 1 and 2. HIV is not on this list, I will note. It's kind of the way its funding works and who does that work is mostly done by the State Department of Health. So that's not covered here as well, but we can talk about that data if you want to. Okay, let's go to the next slide. Okay, so chlamydia. This is our most common STI that we have in Cowlitz County, and that's true nationally, at least in terms of things that we work on. Spreads through sexual contact. It can transmit to newborns during delivery. If you've ever had a baby and they put some antibiotic cream on their eyes, that's part of the reason, because it can lead to blindness. Chlamydia is interesting. A lot of infections are asymptomatic, so without symptoms. This is why we recommend people who are sexually active get screened on a regular basis for chlamydia and gonorrhea, because a lot of times it can be an asymptomatic infection. So some studies, it kind of depends on what you look at, but 10% of men, 5 to 30% of women actually end up developing symptoms. So the majority of people do not. You'll have discharge at the site of infection. It can infect various parts of the body. Pelvic inflammatory disease is kind of a term, a more severe type of infection, I will say, in women that can lead to chronic inflammation, which can damage the uterus and fallopian tubes, leading to infertility. That's one of our biggest kind of long-term things we're trying to prevent when we prevent chlamydia transmission, as well as treating chlamydia is trying to prevent those long-term outcomes like infertility. Let's go to the next slide. So we're going to look at data for each one. Maybe. There we go. Okay, so big picture, chlamydia in Cowlitz County has decreased over the last couple of years. Let's go to the next slide. We'll kind of look at that. So these are just raw numbers. So you can kind of see our counts. We're in the hundreds. We peaked around 2019, 516. And we've kind of gone down since then. We initially thought, a lot of the decrease in 2020 in STIs was perhaps due to people not accessing care, but we're seeing a little bit of a trend continue that way. So it's a little bit hard to analyze. Let's go to the next slide and we'll look at the kind of the graph over time. So this, the red line is Cowlitz County, the gray line is the state. So we match fairly closely, I will say, in terms of our rate when we look at it per capita, like per 100,000 people. But right now we're about 15% lower, which overall is good news. I'm still a little bit concerned about kind of an overall trend if we look at like the last decade that we're still moving that direction. It's hard to say. We'll see what the next couple of years look like. Hopefully we'll continue a downward trend and kind of reverse some of what we've been seeing the last decade, 15 years or so. Okay, let's go to the next slide. So great, yeah. So we did have, a significant increase kind of over the 2010 to 2019, both in Cowlitz County and even greater increase across the state. Let's go to the next slide. We've been seeing a trend downwards since 2019. I will note one concern I have about this is access to healthcare. I think that is true for lots of parts of the state, but I do worry specifically about Cowlitz. And maybe we're just missing people, honestly.
Dr. Krieger,
Yeah.
excuse me, didn't you start working for us about 2019?
That's exactly when I started working for us. Thank you, Commissioner Weber. I'm not going to take credit for that, but I appreciate you bringing that up. Okay, let's go to the next slide. So right now, as kind of the title says, we're about 10 to 15% lower than the state in terms of our rate when we compare numbers. All right, let's go to the next slide. Okay, gonorrhea. Also spreads through sexual contact, can also spread to a newborn during delivery and lead to kind of significant infections, especially in babies that are born early. The data on this is not as clear, but more also a large number of asymptomatic infections. But man, when I looked at the research, it was between 10 and 80%, kind of depending on what population you're looking at. So I didn't put any numbers up there. Similarly to chlamydia, you often have discharge and pain at the site of infection. Can also lead to pelvic inflammatory disease, can also lead to infertility in women and also in men, although it's much more rare in men. Gonorrhea can infect your entire body, especially if you have a lowered immune system. That's called disseminated gonococcal infection. It's rare, but can be fatal if untreated, especially. All right, let's go to our numbers. Yes.
A question, please. You mentioned the asymptomatic. What's the prognosis for an untreated?
Yeah, that's a great question. It kind of depends on a lot of factors, but in some people, it will kind of lead to some chronic inflammation. Again, especially in women, that can lead to infertility. Some people will clear it on their own. But
By that, you mean your body will eventually perform?
yes.
Okay.
Yeah, and I would say that's different than, say, syphilis, which we'll talk about a little bit, which very rarely clears on its own and often leads to very chronic long-term issues. Yeah, it's a great question. Okay, gonorrhea. I feel like I'm already taking up more time than I wanted, but we will, similar kind of data. Let's actually go to the next slide too. There we go. I like looking at the graphs. We had an outbreak in 2006 of gonorrhea, which is that green spike, where we had a lot of cases, more than usual. And then we have this kind of similar trend where throughout the 2010s, a general increase in gonorrhea. And then we've had this divergence, divergence from the state, I will say, since 2019. Actually, it's kind of started in, 2019, where we started seeing a decrease in Cowlitz County. The state has remained more flat. So right now we have 50% lower numbers than the state. Again, I will kind of, I will state, I do worry that we're missing some numbers, but overall, I'm not going to complain about lower rates of gonorrhea. Let's look at the next couple slides just to highlight a couple things. So yeah, a large increase kind of in that decade, both in Cowlitz County and across the state of gonorrhea. And let's go to the next slide. We've flattened in the state, and we've seen about 40 to 50% decrease since 2018 in Cowlitz County. Okay, let's see.
A quick question on that. It's really dramatic that the growth factor was 6 or so. Was there any external event that ties into that?
Yeah, that's a great question. I will say that trend mirrors statewide, as the last kind of graph showed, it mirrors statewide trends, but also national. And I've done some reading about why, and no one has a clear answer. There seems to be, more risky sexual behavior happening, leading to more transmission. These are rates, so it's not completely explained just by population growth. So yeah, I don't have a great answer. There wasn't like some sort of clear event that led to that. Okay, this is the last disease I'm going to talk about. One thing I didn't talk about this in this slide, I'm focusing on kind of public health data, but all of these are treatable through antibiotics. We strongly encourage people to be screened if it's appropriate for them. Syphilis, slightly different transmission. It's really mostly just infectious during the first phase. There's kind of different stages of syphilis. Someone has a syphilitic sore called a chancre, that's how it's transmitted by contact with that. Also can be transmitted not just during delivery, but actually we're more worried about syphilis during pregnancy. This is called congenital syphilis. And unfortunately, we have seen a rise in that across the state. And we've seen a couple cases in Cowlitz County over the last few years, but not a huge increase. So symptoms in terms of syphilis depend on the stage of infection. Starts out with a painless sore, and then develops a skin rash, fever, swollen lymph nodes. It can essentially infect pretty much any other part of the body. But what we're most concerned about with people with kind of advanced syphilis is it can lead to blindness if you have ocular syphilis, so syphilis in your eyes. You can also have it in the brain, leading to a wide variety of kind of neurologic symptoms, and can also lead to permanent damage. This is, if you hear about like people throughout history who may have, people think may have had syphilis, sometimes that's what gets talked about as kind of their late stage symptoms before, we had effective treatment. Let's go to the next slide. Okay, let's do a couple. Perfect. So lower numbers overall, which is great. Although again, I will note kind of a significant rise, kind of the late last decade through 2018. Let's go to the graph in the next slide. Thank you. So prior to 2017, it was kind of hard. We had such low numbers. It was hard to calculate our rate. But the blue line is Cowlitz County. The gray line is Washington State. We are, again, kind of divergent from the state, although the numbers are low, and it's gonna be a little bit noisy because of that. So in the past, we had higher rates than the state. We're currently lower. And we'll, again, kind of see what happens. This is, unfortunately, you kind of see that. Thank you for putting that up there. You see that spike across the state in 2020 and 2021. That is continuing into 2022 and 2023, where we're seeing just quite a bit of syphilis transmission, as well as congenital syphilis across the state, which is a concern. Okay, let's see.
A question on that?
Yeah.
At some point, and it may be my ignorance about the health officer, but in HHS in general, when I see a number going from 4 to 14, and we were already in small numbers there.
Yeah.
I would have guessed that the medical profession would be involved in, say, tracking and talking and so forth. Did we get swamped? Is that what I'm seeing here? Because 4 people
14.
isn't really that significant, I think. I mean, it is to them, of course, but I'm just talking about numbers.
Yeah, and from 4 to 2018 is 4 to 55, and yeah. So when we see these things, so part of our work, our nurses at the department, it is contact tracing is a piece of that work, which is calling people, trying to get a hold of them, trying to understand who they may have had contact with and who they may have transmitted to, and then making sure that they get effective treatment as well to try to prevent further transmission. I think to your question, if we see something concerning, and I will say we've put out regional alerts around syphilis, I want to say both in 2021 and 2022, because we were seeing kind of regional rates rise, where we do try to kind of gather our resources in terms of healthcare providers, make sure that they're screening people appropriately, and just kind of being on the lookout. Syphilis, especially is one, not a lot of providers have ton of experience. I mean, even if you look at our numbers, while they're significant, not every provider in the county is going to see a syphilis case this year. So we try to kind of keep that in people's minds so that they're aware, screening the appropriate people and treating as appropriate. Does that answer your question?
Yeah,
Okay.
in the same vein, when we go from 55 down to 21 in a couple of years, that also makes me ask a lot of questions. What you're thinking there?
Yeah. Again, I think it's harder for me to talk about 2019 because I'm a little bit unsure. To me, the people not accessing healthcare during 2021 and 2020 makes some sense. Syphilis, especially, if you don't go kind of while you have symptoms, it can remain dormant for a long time. So I do wonder if, there's a number of kind of asymptomatic syphilis cases that we're missing. Otherwise, I don't have a great answer. We continued to kind of do our work around it. But I don't have a big change that happened in 2019 that I can explain.
On something like syphilis, which is very dangerous,
Sure.
Are you contagious if you're asymptomatic?
Usually not. Most of with syphilis, sometimes you can have very subtle symptoms that people may or may not notice, and they may be infectious at that point. But the vast majority of transmission occurs when people are symptomatic and like clearly symptomatic. Yeah. Although I will note, you're most infectious. I talked about this. You have it's called a syphilitic sore or a chancre. That is completely painless, and some people may not notice that they have it.
And so as a process, if I'm an sexually active young person, not to besmirch the young person, but is that something where as a policy you would recommend get yourself checked out at what intervals?
Yeah, and it kind of depends on your age, and we didn't get into like demographics, but it is true their rates are higher in younger people kind of across the board in terms of STIs. So younger people, if you go for a regular checkup with your doctor, these sort of tests should be recommended. And the other piece that comes into that is kind of your sexual activity, right? So if you have multiple partners, kind of over a shorter period of time, you'll be recommended to be screened more often. So that's part of that kind of provider patient, communication is talking about those sort of things and figuring out what's most appropriate for you.
And often means 3 months, 6 months, a year?
Yeah, I could pull up the guidelines. I don't know them off the top of my head. For most people, it's once a year, but some people it's recommended more often. Okay, I think. Thank you. Let's go to the next slide. These are great questions. Okay, so I've mentioned congenital syphilis. Across the state, we've seen a dramatic increase. Cowlitz County, and this is true of like most, a lot of kind of public health things that have small numbers. It's hard to talk about. We've had fewer than 10 is what I can say kind of with confidence. We had 0 cases from 2002 to 2017, and then we've had some cases since then. So again, a problem. It's not huge numbers that we're seeing in Cowlitz County, but honestly, I'd prefer to go back to where we weren't seeing any cases at all. And this is also true across Washington state. Okay, let's go. My computer died, so that's it. All right. Thank you for your time, and I'm happy to answer any other questions.
Thank you, Dr. Krager, for your presentation. One comment. I read a study that said that syphilis of those, let me ask first question, the gonorrhea, chlamydia, and the syphilis, is it only the syphilis that attacks the brain?
Oh, that's a good question. gonorrhea can lead to kind of like body-wide infection that could infect the brain, but that's pretty rare. And syphilis is more known, again, if you kind of let it progress to attack the brain, yes.
And what I read was that the highest rate of syphilis is in Washington DC.
I don't know that off the top of my head, but yeah, that may be true.
That's a different kind of syphilis.
That's what I read. It was meta. So thank you very much.
Yeah.
Anybody else have any question for the doctor?
Yeah, if I know I'm contagious with any of these diseases and I do not change my habits, what does the law prescribe for?
Not
for that?
much. Yeah. You know, I think in the past, there had been laws specifically around HIV, and even those have changed recently. I'd have to double check, but I want to say they've changed in 2019 or 2020, changing penalties for, and it kind of depends on, how you describe it, intention, right? If you're trying to, actively infect other people, versus being careless, right? So I would let lawyers kind of speak to that. But in terms of these infections, I'm not aware of any kind of laws that, talk about consequences if you're, not being careful.
In the absence of HIV, should I infer anything from that?
I'm not sure what you mean.
Is HIV not a problem at all? We don't even
Oh.
think about it anymore?
No, it's definitely a problem. And while we don't have, gosh, I should have looked at the numbers. We see, I want to say between 10 and 20 kind of new cases of HIV in Cowlitz County a year. So again, not huge numbers, but it is still a problem. And obviously it's a lifelong infection, right? So we're treating people, for a long time. I left it out of this presentation because, again, that is one where our state partners kind of do that contact tracing work. So I focused on the work that Cowlitz does specifically, but it is still an issue, absolutely.
Thank you
This is
again.
Mary Jane, if I might, I wanted to go ahead and thank you guys for going ahead and having this. I think it's important to talk about these kinds of public health issues that are among us and impact people in a lot of negative ways. So I appreciate the presentation.
Thank you, Mary Jane.
So with that, since we ran late, we started late, I'm going to go ahead and close the meeting. So some items will go over to the next meeting when we have that. And thank you very much.
Mr. Chairman,
Oh. Yes.
you had mentioned holding over till next week the medical freedom resolution. Is it your intent to work with the lawyers to revise it so that it's legal?
I think we always have to work with the lawyers.
I mean, it'll be a different resolution next time, right? Or no?
Yeah, I've seen the emails and yeah, the chairman's been working with the lawyers. I think there's still a fair amount of work that needs to be done. I think for something like this, the lawyer's admonition to date has been pretty important. And I think we should strive for something that gives this spirit of medical freedom, but keeps us out of stepping across the line. And I think that means working with the legal team again. Thank you, Mr. Chairman, for putting out the first, what I'd call a straw man. And that means we're going to throw darts at you for having put your neck out. But I think this is key enough that we don't want to repeat what has happened to some of the other counties. And but that's just my opinion at the moment.
So for the board's information, we are in the midst of our budget process for all of our departments, including Department of Health and Human Services. we will probably be determining the budget for that department before we meet again, I think. And, which means we have another year that this health board hasn't made recommendations on the budget.
I see what you're driving
I
at.
see, yeah, that, I'm sorry to cut it short, but one of my notes is exactly that. You had said some of the things that we have to focus on. And I will, if you could please drop me a line, send me an email of exactly what that is, and let's put that onto the next meeting's agenda. Yeah.
Mr. Chairman, I know you're trying to close the meeting up, but I think there are several people here that came to speak to the proposed medical freedom issue, and if it's something you're going to be considering, and there's time available, I think there are a number of people here who would be interested in speaking to that and getting more input from Board of Health, looking at that.
Yeah, it hasn't been officially proposed, but if somebody else would like to say something about it.
Thank you. I appreciate your interest in hearing from the public.
Always.
Um,
I work for the public.
Thank you. So today I do want to address the proposed medical freedom resolution that was published in the agenda. It sounds like maybe there is some behind the scenes discussion going on related to that, and it may change in the future. But I wanted to speak from my experience as a public health professional to my reaction and observations about that, what was at least currently proposed. So when I worked at Cowlitz County Health and Human Services, I did complete extensive emergency management training as a part of working at the health department, which was a great opportunity for me to learn about how the county responds in an emergency. What are the structures put in place so that the county can respond quickly and effectively in the midst of all sorts of emerging information where you might not know what the particular emergency is, and you're trying to make decisions quickly. So there's a whole emergency operation structure that gets put in place when emergencies start. So I had a great opportunity to learn about that. And actually, when I was working at the county, we did a public health exercise where we did a simulation of a public health emergency in our community. And we were able to partner with law enforcement and other people that would activate in an emergency situation. We got firsthand real life experience about as close as you can get to what responding to a public health crisis is like without actually having an emergency in our community. And then the last bit of experience that I'm speaking from today is from working during the COVID-19 pandemic, where I worked for 7-county accountable community of health that included Cowlitz County. And we had the opportunity to help with part of the response. We developed a program that helped people stay home in quarantine and isolation when they were determined to have a positive COVID test. So our program helped them get deliveries of fresh fruits and vegetables so they could stay home and not have to go to the grocery store. And it provided them with connection to other sorts of assistance if they had a financial impact from needing to stay home in quarantine and isolation. So from all of that experience, I really would urge you not to pass the resolution as it is proposed. It would severely hamper the ability of our local public health system to respond to future emergencies. Contagious diseases and other infectious agents are a key type of emergency where a local public health response is needed. If an event like this were to occur in the future, we want our local public health system to be fully equipped to rapidly respond with all the tools it may need to prevent the loss of life. Quarantine and isolation and strategies like masking and ventilation to control the spread of infectious agents are the tools public health uses to prevent contagion. While people may have concerns about how those tools were used in the recent COVID-19 pandemic, this resolution would apply to future emergencies that are likely to be entirely different. We need our local emergency response to react in a timely manner to the on-the-ground situation with the actual emergency that is occurring. If quarantine and isolation or other measures are needed to stop or slow contagion, there is a strong precedence already established in law for public health to exercise these powers, such as with the controlling the spread of tuberculosis. And a health officer is exactly the type of highly skilled and specialized position needed to exercise how and when such powers are used locally. The public health officer is a key figure in responding to a local public health emergency. Stripping them of power 24 hours after an emergency is declared, unless there is approval from a 7-person board that may not be able to be convened in a true emergency, would be harmful to the emergency response operations of our county. Similarly, requiring everything related to the response to be vetted and approved by the Board of Health would severely hamper the national standard for responding to emergencies using the emergency operations structure. During an emergency, we need to trust and empower our local staff to act responsibly. The emergency operations structure and procedures are proven to be effective, which is why they are used nationally to manage any emergency that occurs. Inserting the Board of Health into the emergency command structure would not work. Another problematic idea in this resolution is that no county assets can be used for something that one day may be deemed unconstitutional. Fiscal management during an emergency cannot operate under a wait and see if we decide this is okay in the future mindset. The county needs to deploy assets rapidly, and the county's emergency management plan has structures for controlling and accounting for those assets. With the mix of state and federal assets that come into a county during an emergency, clawing back Cowlitz County assets that were used inappropriately according to this resolution, if they were deemed to be used inappropriately at some future date, would be an expensive and time-consuming undertaking. If the resolution had been in place during the pandemic, it would likely have delayed or prevented my program and many others from helping people in our county stay home when they were sick with COVID. We worked with the health department to refer people to our program. If they had needed Board of Health approval, I'm not sure the Board of Health would have had time to consider our program with all of the other pandemic-related issues like masking and infection control and all of those other things that were being considered and discussed at the time. In my experience working with Cowlitz County employees and monitoring the overall pandemic response across several counties, I believe the staff in Cowlitz County, the current health officer, and the whole emergency operations command run by the county was very effective at many of the challenges they had to face. I also know there was ample room with the emergency operations structure for the Board of County Commissioners to stay informed of what was happening and to provide their input in leading the pandemic response. And I'm sure in future emergencies, the Board of Health would have a similar opportunity to participate in the response. This resolution would not have helped our county during COVID-19, and it would potentially harm our county in future emergencies by disrupting effective emergency management practices. I urge you all to vote against this resolution. Thank you.
Thank you for your comments. I'd just like to say that closing the schools down for 2.5 years and arbitrarily closing some businesses but not others was not what you say is effective from last time we did this. That's just my personal opinion. So with that, any board members have any questions, comments? Okay, we'll adjourn the meeting.
Actually,
Yes.
if I could ask the gentleman one question, we did set a Wednesday late day once a month at essentially his request. And we've done that maybe 6 months worth, and I've seen him there only once. Is there an issue? You don't like the material we present, or did we pick the wrong time?
Look, he's asking you a question. We
Yeah, no,
gave
he-
you plenty of time. He has no further comment.
Yep, he answered.
Okay. Thank you. We'll adjourn now at 12:25. Thank you very much. Thank you for your patience and your time to be